this is almost goes imperceptive. Thank you. Imperceptive. It goes very silent, very silent, and suddenly you end up with the major chronic disease, like diabetes, not well controlled diabetes, has a big inflammatory component there. Major cardiovascular disease has an inflammatory component there. The artery problems, the arteriosclerosis start with inflammation, and those ingredients of inflammatory chain will start to stuck in the internal wall of those veins, of these arteries, and then start the inflammatory reaction there. So that would cause a big problem. So I think we have to be really aware about this. So as I said, the acute inflammation is good, is positive, is to defend ourselves. I am beaten by an external, I have a wound, etc. The organisms tend to limit that area, you know, calling a lot of cells to limit the wound. So but this has to go away as soon as the thing is resolved. That is good. But what is dangerous is what we call chronic inflammation that leads, including to damage of DNA. So you start to cause mutation. You know, mutation is underlying many tumor cancers, is mutation. So if it happens in a rate that we cannot get rid of, because mutation happens in certain rate, is normal thing. But the organisms have ways to repair. But if it starts to happen in a rate faster than you can repair, now I have the consequence of this mutation. And these abnormal cells say, well, I'm not going to follow the control. I do myself. And they start to grow. And once they start to grow without control, the nutrients, they rob all the nutrients. So the good cells cannot survive. They only, you know, the nutrients used for them. It's a very selfish mode of these cells and can grow many places. So you have this what we call inflammatory microenvironment, which is a lot of pro-inflammatory markers that were released, you know, by this initial inflammation. And then the tumors start to initiate, then there is a promotion, progression, invasion, and metastasis. So they are very aggressive. They don't follow rules. Say, you go, but I have to go slowly and maintain the equilibrium. No, they don't care about the equilibrium, the harmony, the homeostasis. They really go for them. The other things that is related to inflammation is obesity. And we are learning more and more that the adipose organ not only carry the fats, the cells, their own cells, but this called adipocyte, but they carry a lot of immunosystem cells, macrophage T cells that belongs to the immune system. So once you increase a lot of this organ, of course you're going to have more of these cells. So these cells can be activated by this initial, you know, imbalance, aggression, and then the real inflammation. This is still silent. Then the real inflammation can start to be expressed. So you have the they promote insulin resistance. Insulin cannot work, cannot do its job, so become insulin resistant. So they block the work of insulin. Type 2 diabetes, which is insulin resistant, and usually related to obesity. It's not the type 1. One is the infantile mellitus type of diabetes. Most of the cardiovascular disease is related to inflammation, cancer for sure because of the mutation, and a lot of immunodysfunction. So we start to get more prone to infection, chronic infections. And of course, we can shorten our life if we don't take care of this issue. So what is more and more clear to the scientists, that we have what is called oxidative stress, which is the trash that is produced once in many normal biochemical reaction. But if you produce in high amount, there is no way to get rid of that. We have system to get rid of that. The lymphatic system, the lymphatic system in the brain, to get rid of the garbage. But if you produce in great amount, then you start accumulate. So then you're gonna have, what is caused this chronic infection, obesity, alcohol, tobacco use, radiation, environmental pollutants. We have a lot. High-calorie diets are the major risk factors for a variety of chronic disease, from cancer to metabolic disease. So this oxidative stress is parallel to inflammation, is the base for inflammation. All these risk factors are linked to chronic disease through inflammation, while short-term acute inflammation generated by the immune system serves as a therapeutic role. Chronic low-level inflammation that may persist silently for decades is responsible for chronic disease. So we have to pay attention. The problem is that it's silent. We don't have a bruise, we don't have redness, we don't have swollen to say, uh-oh. We are more worried about things that is not so important, So then, of course, in the book, he stressed the role of dietary agents such as fruits, vegetables, legumes, pulses, what is that? I don't know. Nuts and spices as ideal anti-inflammatory agents that can be consumed regularly. So we have ways to prevent and to decrease. We have to do this slowly, but every day. The other things that I want to talk about now, going more to the mind, to the spirit, are about our emotions. How bad those emotions are for our health. They are very bad. They are toxic elements. It's almost swallowing venom, So let's see. Do we have some of those negative emotions? Jealousy, frustration, sadness, shame, fear, grief, guilt, sadness, depression, despair, envy, doubts. I think we, in some percent, we have all of those. Some days more one type than the other, but we all have. So I think we have to be aware in order to limit how long we're gonna feed those negative thoughts. Once we know how bad it is, we try to change, right? The course of our... In this book that Leo is almost finishing, there is a chapter called Health. Emmanuel, and in 1958, imagine, last century when we were not even talking about all this influence of this thought, psychic mind in health. He said, feelings of anger, despair, cruelty, and intemperance create morbid zones in one's organic structure, which is our body. Morbid zones, imagine. They cause a state of dissonance in the cells, which neutralize nearly all their defense mechanisms and renders the weaker organs a fertile ground for pathological germs. So we start, those are, so the inflammatory immune system problem, and we start really to not to have a defense mechanism anymore. So we start developing infections, cancer, because our immune system is not working. So in 1958, he was already saying this. You know, pay attention on those feelings. It's not, oh, I have the right to be angry because this guy, you know, did that, that woman did that. Right? But then you get sick. For what? You know, the guy even don't remember that what upset me, you know, in the traffic, having a good life. And I'm still here for days, upset and swallowing this toxic venom, you know. And that is why tuberculosis, at that time now is coming back again, tuberculosis, cancer, leprosy is coming back again, leprosy. And ulcers are many times secondary phenomena caused by the imbalance of the mental reflex of one's thought. So Leo said that. So not only this disease is going to be more severe, but the treatment response will be lower. That's the problem. And then in the other chapter, in chapter 28, illness, he says, every strong emotion that reaches the body is like a hammer blown on a sensitive machine. We are a sensitive machine, but we are allowing our emotions that look like a hammer to bump us the whole time. When there is an inner conflict, look, the conflict is bad. Most of the times, the salivary glands cease their flow of secretion. The stomach becomes spasmodic of contractions and refuses to produce the choleric acid, and then results in a digestive malfunction, manifesting as mucus colitis. So many of the gastrointestinal that we call, you know, chronic immunoreaction, immunodisease, has the basis of emotion, you know, retain bad emotion. The first stage often opens the door to serious organic disorders. The abnormal state of gastrointestinal system, if recurrent, coming back again and again, will damage the nutritional process that in turn affects the nervous system and result in extreme mental balance. Only in 10 or 20 years ago, we start to relate the gut to mental disease. It's very recent this, that we now say, you know, the Parkinson's disease or some mental disorder is coming from the gut. That was said in 1958, and we are only now saying this, stressing this. Treat your guts, you know, balance your guts. In this book, she says, is also, how can emotions transform the body, either creating disease or healing it, maintaining health or undermining it. So it says, every change in the physical state is accompanied by appropriate change in the mental, emotional state, conscious or unconscious, and vice versa. That means All the emotional state can also consciously, unconsciously change the physical, affect the physical body, you know. There is a mind-body connection making us aware that our thought, emotion, and attitude affect our state of health. Norman Cousins suggests, from his experience, he had a very big, serious illness, and he says that he got rid of his problem, this collagen disease that would lead to a heart attack, by treating himself with laughter. He postulated that the laughter triggered a release of endorphins, which are the very powerful analgesic, look like morphine, but is endogenous. We make them. By elevating his mood, somehow brought about a total remission of his life-threatening collagen disease. So let's laugh. Even if it's fake, look, the brain doesn't know it's fake. The brain is a full machine. You can start to pretend, and then if the other person starts to laugh, everybody's going to laugh, and the brain is going to take as real. As real. So let's do this laughing. Doesn't matter if the person is silly. Well, silly, but I'm healthier. You know. Our emotions are also influenced by greater spiritual energy field, which we know in spirit, we all immersed in this universal cosmic fluid that influence the entire physical body and nervous system. Our reactions to life are recorded not only in the biochemical patterns of memory storage in the brain, but also in the life energy centers. We have many energy centers, and we spirit says in the perispirit, which is the mode for the spirits to change or to influence, and then finally to the body, and help to nourish our cells and organs. So we are surrounded in this life, in this energy field that affects our energy centers, which in turn affects the organs that they influence, all this. We are energy beings whose ills may be healed not only by surgical surgery, procedures and drugs, but also by different forms and frequency of energy. So there's all this magnetic healing, all this, the prayer and the fluidic water, they're all energized with the good frequency in order to put us in tune with the good, you know, to get our balance back. Because we are energy. That they say if the nucleus is a little ball in the center of a football field, the first electron is outside of the field. Everything there is an empty, quote unquote, empty space that is actually filled with energy. Filled with energy. So we are basically energy. We're not solid. So here is a summary, more in a cartoon type. Anger affects especially the heart. Blood pressure goes up. Oh, this you know, we always say, I got so angry that my blood pressure went up. Heart disease, if you repress anger, you know, headache, how many times we could not say that bad thing, respond to our boss, you know, because it was not convenient, whatever, and then suddenly we have a big headache, migraine, you know, fibromyalgia, all the, because we restrain ourselves. Of course, we cannot say, but we have to use our tools in order to, once we enter we get isolated, get rid of that. We have to have some protocols. Look, once I go to the bathroom, I wash my hair, my face, you know, calm down, get some breathing. But to retain for hours, days, that's what causes And if you have anxiety, that's so common among us. We all know when we're anxious to do the test in school or interview, oh, we have to go to the bathroom. Then we have a heart, some palpitation. My heart seems to go exploding. We have all this because of the anxiety. And resentment, they say, I have to pay attention to that. Autoimmune disorder, rheumatoid arthritis, lupus, multiple sclerosis, some resentment got more to the joint area. Stress. We have to manage our stress. We have to learn how to do this. So we have a lot due to heart disease, suppression of immune system. So let's see how it works. So we have a persistent stressor. It can be any situation, money problem, some bad coworkers that pokes every day, oh, I have to go there, and traffic, whatever stressors you have every day. So then, because I'm stressed, we do worse. Because we start to smoke, we start to drink, we start to yell, we start not to sleep, we start to have poor nutrition. So summate this, bad stressors, big stressor, and plus this terrible habit will increase a lot the release of stress hormones, especially cortisol. And that will be damaging to heart. Our immune system will be shut down or overstimulated, but not in balance. And then we have what we call autonomic system effects, headaches, hypertension. It's another way to show. So what to change? Just to put a mask, change the mask, a happy face, whatever, So Benny Siegel, he's a very good doctor. He was a surgeon, cancer surgeon. And Divaldo Franco got one nice talk in Connecticut, or I think it was in Connecticut, how many years ago? 10 years ago, 2008. And he, against his will, he became a spiritualist. Because as a surgeon, he has nothing to rely in things that is not related to his skill to diagnose the cancer, to give the prognosis, or to remove the cancer, or to treat the cancer, and there's 6 months to live. That's what he was doing. But then suddenly he was forced to change the way he sees disease, because certain patients came to teach him this is not all. Because the guy said, didn't do what he said to do, and he was healed. What is called miraculous remission or spontaneous remission. So he says, I believe that we are here to contribute love to the planet, each one of us in our own way. So he is calling our attention, our feelings, our well-being, mind, body, mind and emotion, and spiritual, makes the whole difference in the physical state, disease and health. In this book, Love, Medicine, Miracles, he tells us a lot of stories and cases. So he says, when I began working with the group called Exceptional Cancer Patients, I noticed many of the group lived longer than their doctors expected, more than that 6 months that he gave. I wanted to know why. I began to observe and inquire and noticed that the long-term survivors were the ones who began to pay attention of their feelings, not to deny. We have to be aware. I'm angry. Let's accept that and then do something. But to deny, to pretend I'm a cool person, very politically correct or whatever, civilized, sometimes there's a big price. As they expressed their emotions, made wise choices, and became more spiritual, their bodies benefited. The physical changes were the side effects of an altered life. So you alter the life, you change the outcome. What approach should you take to your illness? He says, I have 3 words of advice: accept, retreat, and surrender. Those 3 words might scare you if you were an experienced warrior going to battle, but others who have employed these tactics have won great victories. So he was interesting because we usually, when we go to Google or whatever, to internet to see what are the tips, I think he got tired to say, please do this, do that, sleep well, to get healthy, whatever. He decided to do the opposite. How to get sick and stay sick. Because he wanted to really, shock the patients, because he was not getting it. So he said, how to get sick and stay sick, by Bernie Siegel. He signed it. Complain all the time about everything. Be irritable, resentful, hypercritical towards yourself and others. Ooh. Don't pay attention to your body and eat plenty of junk food. Practice unsafe sex. Do things you don't like and avoid doing what you really want. Fill your mind with dreadful pictures and then worry most, if not all the time. If you are overstressed and tired, ignore it and keep pushing yourself. Avoid deep, lasting, intimate relationships. Be isolated, me and me. Blame others for your problems. Do not express your feelings and views openly and honestly. If at all possible, do not even know what your feelings are. So how many of us, we do that? Pretend. So in another set of advice, anger, disappointment, resentment can't be erased, but they can be, decrease the effect. Prepare yourself ahead of time. So they say, select the situation. If you know that situation always gets you angry, gets you resentful, why avoid it? You be intelligent, smart. Modify the situation. Attempt to reduce your disappointment. You say, well, that I cannot get it. Why can't I set the bar lower, to offer to do something else? Why be always disappointed with myself? Change it. Shift your attention. Shift your attention focus. So instead focusing what the other people think about me, let's focus on me. Oh, I'm good. I can do that. Change your thoughts. That we always say, change your thought. Replace by good ones. They say at the core of our deepest emotion are the beliefs that drive them. We believe in this. You feel sad when you believe to have lost something. Anger when you decide that an important goal is thwarted, and happy anticipation when you believe in something good is going to happen. So we have this relationship. People with social anxiety disorder may believe that they will make fools of themselves, that they will, in front of others. So we have to not to suffer so much of this, just do something that will bring contentment. Replace the unhappy one for the thoughts that will bring joy and contentment. Joy. Change your response. Well, if I always get upset, change. Don't get upset. Try to modify how you respond to the events. Say, well, I am in the process of getting to be a bad person. That person, if he is already good, probably was not supposed to be in the planet Earth if it's so perfect, you know. But no one is so perfect. We are here to trials and to try to make all the tests. So we are in the same level, you know. So just don't put too much importance to others' opinion. Let it go. This is a good thing. Let it go. Extreme negativity, let it go, the extreme negative. Regrets, self-pity, you know, cruel thoughts, unnecessary anger, you know, self-doubts. You let it go. This is not important. So your thought creates your future. If my thought creates my future, I better have a good thought. Think positive. Good thought. You know, so tomorrow will be better because today I start to be better. And then I would have a happier memory, right, Chris? Yesterday, today's become memories of yesterday. So let's change this, our memory pattern and look forward for the future. So a little bit overview of this, to tackle a little bit more about spirituality. So as I said, in the last Spiritist Medical Association Congress in Miami, the title, the theme was Integrating Spirituality in Clinical Practice. So the keynote speakers was Dr. Harold Koenig, and he published this book, Spirituality in Patient Care. What, why, how, when, and what. So he says that, so the title was The Research Evidence Justifying the Integration of Spirituality into Clinical Practice. So he wants to give all the data by doing the statistical research back, I don't know how many years he did, in order to see if spirituality makes a difference in the outcome of clinical practice. And he proves, with some exception, it gives a better result. So that was his purpose. Because he then has to teach. And in order to teach, you have to have evidence. So that's how he was getting the data. So he emphasized the importance of taking patients' spirituality seriously. Because medical doctors and medical staff start to kind of not get seriously and some kind of even give some sign that they're not for that venue. This is not for serious doctor. So they would dismiss when the patient would ask them about spirituality, about prayer. And nowadays, there's some doctors that praying together. They are asking already, do you believe? What is your belief? So at least they're starting to ask questions. So he says that many people turn to spiritual beliefs when they are threatened by illness and loss, of course. It's when we go for alternative help. Today, 2/3 of American medical doctors, medical students, are being taught to perform a spiritual history assessment to optimally care for. So they are trained to go with this planchette and go there and assess that and be thorough, listen, ask correct questions. They are being told that our medical profession has neglected the role of spirituality and religion in the healing of their patients. In his course, he shows the way to any healthy professional seeking to bridge this gap and help patients regain their lives by finding hope, meaning, and healing. some negative outcome is reported for patients, and he believes some spirituality, when they start to practice, they got worse, or they report they're not feeling better. In part, he says, because they have very negative experience with the church or the religious authority. There was some abuse or something. So if we talk about religiosity, they get worse. The physical outcome is bad. So there's some few cases he believes is because of this, how you view this religious authority and religious practice. And this person from around this area, Johns Hopkins, he wrote this book called A Beautiful Medicine, Dr. David Messier. And Beautiful Medicine, Love, Beauty, and Relationship on the Path of Wholeness. I think the interesting thing, he did many things crazy sometimes in his life, but finally he became a very, because of his background, he could check, you know, but he speaks a lot cases of near-death experience and how much those that recovered, they became more holistic, they became more whole, they changed their minds. He recounts cases including he had a very serious terminal disease, and he recovered with, you know, what they call spontaneous remission, but he knows it's not it's not spontaneous remission. There is a cause that we don't know how to tackle clearly, but they all come back more peaceful. They always become a more peaceful person. So the mind, the emotions change the quality. He stresses the importance of integrative medicine, the attention to physical health before jumping to diet, religion, or the energy, spiritual health. So we cannot dismiss the physical body. The physical body is in this non-balance or sick. We have to treat first the physical body. We cannot say, well, you don't need the faith or the religion or we'll have. No, we won't. We have first to put in balance the physical body. And that sometimes needs drugs, pharmaceutical company that gives out those drugs. Then you put together as integration, you put the more holistic, you know, care, including psychotherapy, that is to see the root cause of this imbalance. But if the body is already damaged, you have to repair. And then you go to the root cause, which usually lies in the spirit, emotions, you know, the way we see life, etc. And then we go to diet and healthy, activities that will accelerate the healing and make you be, you know, healed, truly healed, and not have a recurrence. This lady, Elaine Driscoll, she's a psychiatrist, and she works a lot with near-death experience in medical practice. What is interesting is that they say, going against mainstream attitudes in Canadian, she's from Vancouver, healthcare, Driscoll has been quietly teaching patients, medical students, psychiatry residents, palliative care staff about the benefits of understanding what happens to people who return to life after appearing clinically dead. So even those that did not she told the story of a woman, a lady that was, or a young lady that was having this recurrent desire to kill, to commit suicide. So she started to do many ways to reach out for these patients. And finally, what helped this young lady, when she started to talk about the patient that went through the near-death experience. She said, you know what they did, what they reported, what they found on the other side, and what now they are a different person. So that said, oh my God, so there is another side. There is something else there bad. And the person wanted to come back, asked to come back, and they changed completely. So they say that these stories that she started then to tell these patients, it helped a lot to change their mind, those that want to go to severe depression, they want to commit suicide or for other reasons. The things that I thought was very interesting that was in one of her questions was made to her, and she says that even faith that seems so, how to say, not physical, it depends on the health of the brain. When you are really depressed, you cannot express faith. You cannot even pray. You have to ask other people to do with you. So it seems that this faith passes through some areas of the brain that is the same area that is affected, and it causes some imbalance that we call depression. And then the opposite, when the bipolar patient is in this phase of mania, they report and they act with a hyper faith. This is the opposite, Except, so it's interesting that they say until you try to balance the neurochemical imbalance that you are in, you cannot even think about God, think about, spiritual, well-being. You have first to treat the physical. And then slowly you regain this ability to pray and to express your connection with God. This guy, spiritual care counts more than we knew. Whose job is it anyway? David Sledge, I think. So he says that 77% of patients prefer discussion about spiritual issues, while only 20% of the physicians are ready, prepared to talk. So now there is a big demand from the patients. I want a different treatment. I want you to talk to me, not about that cells or that image or whatever. I want you to talk, to connect with me. Look at me. Sometimes they don't even look at you. They are in this computer screen and they don't even look at you. It's terrible. But that's changing. A couple of days ago, I went to my annual physical. A young guy, oh my God, he knew everything. Because he was very fast in the computer, he didn't even need to read it, to see the computer. He was all looking at me. And he knew everything. He discussed with me from my exercise, for my insole that I asked if it's good for my pain or whatever. He could discuss everything. This is the exercise. Oh, go to the exercise, the video. What I was eating, what kind of meal you have. Young guy. So he's a new generation, asking correct questions. Oh, what kind of exercise? I said, elliptical. And so No, you have to do the impact exercise. Because for you to decrease your cholesterol, your glucose that was in this borderline, you know what it is? You drink this calcium, whatever thing that you drink, but it just go to the guts. But to absorb, you need to exercise, bump, impact. So change your exercise. Do more of walking, running, and weight lift. So he knew everything. I said, oh my God, we're getting there. If you get an old physician, no, they don't, do some exercise, 3 times a week, whatever. It's changing. So he says, he gives reason for medical schools, the students, faculty, alumni to include a focus of awareness of the interconnectedness of the spirit and medicine. We are spirit. They have to treat me as a spirit, not as a body. That is not enough to cut part of me and say, go, no. So these 2 Brazilians also were there. I'm not going to talk much. Alexander Moreira, he's long time, including he was a postdoc student of Dr. Koenig in here, but he's been, because Brazilian medicine is integrating a lot about this spiritism in their care. So he's all involved in this a long time, and he wrote, or he's an editor of this book, Exploring Frontiers of the Mind-Brain Relationships. So he gets some mediums or some very spiritualized people and see how the brain scan, MRI, is to see if there is difference, how is the outcome of the treatment. And Sergio Lopez, of course, he talked about these 3 parts of the brain. The brain is divided in 3 big areas. The very primitive one, then the middle one, which is all emotional and holds all these heavy emotions, and then the new part, which is the new cortex, which is more rational, more spiritual, more moral. Everything new that human being acquire is in this new cortex, frontal cortex. Oops. And this guy called Jeffrey Rediger, he was he's very famous because he appeared in Oprah, and he was in TED Talk also, and he's, I think, in Johns Hopkins, Medicine of Hope and Possibility. So he came more to talk about cases of people with a very fatal disease like pancreatic cancer, and that had a miraculous spontaneous recovery. So he is putting forward this idea that because he went to Eastern country, I don't remember what country he went to learn about Zen Buddhism. So he has the Eastern background now, so he's integrate together what he knows in the Western to change the body and mind, or mind and body. And this all that we are energy, so change the energy field. So he went even to John of God, I think, to check, because one of his patients said, you ought to go there, you ought to come here. And he said, no, if someone in the university finds out that I am in there, messing up with this, they're gonna say, what kind of doctor are you, so. But then he said, don't even show this video to anybody, but someone in Ireland, I think, very far, published the video of him with the John of God, doing surgery without, any. But he said he was amazed how this surgery happened without any drop of blood or infection, So Paula can talk more about John of God because she was healed going there. So I have this picture of these two men, very religious men, Dalai Lama and Tutu, the Archbishop Tutu, Desmond Tutu. Those two men passed through such a harsh time in life. You know, Dalai Lama be exiled, and he also, by the apartheid in his own country, being completely out person, you know, be excluded, have no rights. So we have a lot to do how they take life so joyfully, laughing. So spirituality just makes us healthier. So to be gathered like we are here, you know, is good because restore our lost sense of purpose and finding meaning. So we are here gathered, you know, to have meaning, this friendship, this connectedness. Talking with chaplain and other spiritual counselor can help people with fractured relationships and regrets or serious illness. So it's what we do. You don't need to go to chaplain. We just talking to each other, saying something, having a good support is a healing. It's a healing, you know. Of course, you can come on Mondays here for the fraternal assistant. Preventing isolation and the risk of depression. They say seriously, if you engage in these social groups, you know, can be even yoga group, online group, it gives you this sense of acceptance, of belonging. This sense of not belonging is tragic. When the teenager goes to their room and stays, nobody wants, nobody cares, nobody wants me, my parents, this is bad because they don't feel belonging to any group. It's very difficult. So don't let people be alone, you know. So volunteer and be involved in a group helps us to be connected. Providing hope to help relieve. So these groups, by going to these groups, you know, they say there is this common human tendency to be stuck in the moment. But reminiscing about the time in life that was happier or in which they were stronger can take people out of this moment, this struggle. So let's force happier remembrance, happier, you know, memories, because it replaces, you know, this negative thing that we are getting stuck. Improving the function of your immune system, we already said, you know, that we can, when we are sad, we are depressed, our immune system goes down, so we can supercharge, you know, the body by laughing, by talking, by helping, be helped too is important. No? Meditation modifies gene expression and in immune cells and to be less inflammatory. So deactivate a little bit more these pro-inflammatory markers. Enhance your ability to think clearly and positively. They say when we give up to God or to other, you know, high spirits, we get kind of free to think more of other things, you know, and at least to be distracted, because we're not going to talk to God talking about bad things, you know. We're going to at least say, please help me to get better. I'm not going to dump God with all this negativity, you know. So it's a break, you know. Blood pressure level go down, blood flow would increase to the brain. I'm going to be smarter. Now my memory comes back, and I can think more clearly. That's important, you know, when it's foggy, our brain is foggy, it's bad, it's bad. The good thing that is happening lately, I found this lifestyle medicine education. You see how much we are growing in the medical school curriculum? This is finally going part of preventive medicine. And doctors and staff in the medical area, nurse, assistants, nutritionists, doesn't need to be only nutrition. I see medical doctors in Brazil from the system, the basic system, SUS, providing courses to cook healthy dishes. They're all getting involved. So there is also a congress in, I don't know when, beginning of next year, I think, that they teach about this lifestyle medicine education, and they provide all these courses for each one of these areas here. So I thought that nutrition, they teach about nutrition. Not only say this is good, no, show how to cook. You know, exercise, what kind of exercise? That's my doctor asked. You know, what kind? Tell me, you know. Of course, tobacco and alcohol. Stress management, meditation, and sleep. This is my part. How to sleep well. Because I don't sleep well, but I have to be concerned that sleep deprivation is bad for me. It's bad. I'm good in all other parts, but the sleep for me is difficult, you know. And relationships. Oh, this part is difficult, no? Healthy relationships. This we have to really master. We have really to master that. In Spiritism, we say we are immortal beings. We have the whole time, many incarnations to come. And forget, we cannot change other people. We can't. We don't have that power to change other people. So let it go. Just, you know, take care of our own incarnation. Some mothers almost die because of the kid, but you know, there's a time to let it go, let him go. Because there is no way for this old spirit. It's not a child anymore. You know, whatever you have to do, you did. But they're old spirits with their own baggage. You know, so sometimes we forget about our own progress. And also practice not only emotional intelligence. Now we have social intelligence. We have spiritual intelligence. And we have now what is called cultural intelligence. Lot of multinational company, Silicon Valley, that hires a lot of foreigners. They are after acquiring knowledge about the influence of the role of cultural intelligence. We have to be able to navigate across the cultural differences. Because this is money. It's not because they want to be politically correct. It's because to sell their product, they have to deal with all the different people, right? Not only my co-worker that is working that, you know, in Silicon Valley is from Iran, from India, from, you know, Brazil. You cannot create a war zone there. We have to learn about this. And also to deal with, you know, countries that will buy my product. I have to be able to say, oh, I don't like your religion. You're not going to sell. To make money, you have to go through this, you know, cultural intelligence. So that shows the teaching, you know, is the opposite, is the Asian guy standing in the other one. So don't make the, you know, respect. You have to learn. Nowadays, you know how to go there. Don't touch everyone like the Brazilians do, you know. Because there are people that the Japanese does this because there is the distance not to bump the head. So if you both do this, that is the correct distance that you should be to others, you know, not to. So I think it's all this is in the internet, so if we want, we can master the whole, many of these different areas of intelligence and be a good person, a happy person, like Dalai Lama. This guy wrote, helped. If it was the interviewer, they wrote a book called The Book of Hope with those two. You know, so they laugh. You won't believe they touch each other, you know, like Dalai Lama wants to hold the face, you know, like this. You know, and remove, I always say, I can. Remove cut off this apostle tent. And joy. Today, I choose joy. It's different from happiness. Happiness comes from outside. But joy is from inside. It's me. I feel joy. You know, I don't need anybody to make me happy or any circumstance. I feel joy. It's different, you know. Thank you.
Thank you, Yasco. A lot of information for all of us to think, right, process, and
oh my God, it's late.
And well, it's okay. We were learning, and we are processing all of this in our lives. We thank you for all the research that you brought, and food for thought for us to finish this year well and start 2019 as well on the right path, because we often want, as you said, we insist on the healing of the physical body and forget that we are responsible for, we can change, and we can do a lot of easy things besides going to the doctor and help ourselves. We would like to spend maybe 5 minutes or so on a question, a couple questions, if you may have, or comment, before we can go to our final prayer so we can finalize our evening tonight. Anyone would like to make any comments? Okay, Daniel.
One of my highlights of your presentation, Yasco, was what we need to do to get sick. I really like that, and I remember I was in the auditorium 10 years ago when Dr. Bernie Siegel mentioned that. So my comment and question is, maybe this is not a bad approach. You know what I mean? Because, as you said, we have a lot of information how to get health, to be healthy. But it seems that we get more sick, you know. So I don't know. I mean, you put more of your time in this presentation. Do you think that this would be a good way to go in order to impact and to make people realize that, okay, so this, you know.
I think we have to change, like if you ask someone that is in the advertisement field, they're going to say, yes, you have to sell the product. Whatever you need to do to call the attention, to impact the person, you do. You know, that's how I'm sure he said the traditional way many times in his presentation. But he said, let me try to change, to see. And it really impacts you, because we don't think that the lack of health is to be sick. And it is. If I don't have health, I'm sick. So, but we deny that we are sick. We have a poor health, but we still don't accept we're sick. It's difficult for us to say, I'm a sick person. I'm sick. I think that's the same is to impact really us in this phase. You know, it's interesting. If it's a good advertisement, I think, trick, I would say.
Thank you. Anyone else?
In the book, Biology of Belief by
Lipton?
Dr. Lipton, he specifically mentions that to do this, what he's talking about, it's just not to have positive thinking, that he specifically says you have to go into your subconscious mind. Could you talk a little bit about that?
Yes. Of course, we have a lot of repression. We repress a lot of our subconscious. But we can dig out a little bit. You know, it's 5%, like if you picture the iceberg, 5% of the tip is what we are, the ego, what we express every day. We are conscious about what we are, how we react, what my thought is, my recurrent thought. This is that 5%. Then there is this little layer close to the surface that if you dig, it comes. It comes. And then we say, why I'm feeling angry, or I react in an abnormal way if that stimulus was not supposed to trigger this big, reaction. So it's what the psychologist also goes a little bit down to see what are the root cause of this. You are angry, not because of that thing that happens in the traffic, but your set of mind, your mind is set to a level very close to the threshold already because of your relationship or what something that you want to hide, with your parents, with your partner. So the anger, the resentment, all these things, if you have to go down. That a good psychologist will do that in order to now, because you have to first know yourself in order to change. If I keep saying, well, but I'm not an angry person, if I believe on that, and actually I am angry, but I'm just, try to fake, I try to deny, but my cells feel that. Doesn't help me to say, oh, I'm not an angry person, if inside, when I am quiet, I am angry, my thought, my mind. So my cells sense, because this is very, very, sensitive material that carry all this energy, not only transmitters, molecules, but carry this quality of this energy, that goes through the bloodstream and reach each cell. So we are all in this universal cosmic fluid, and depends on the quality, what I grab from that, by my emotion, by my aura, is what I am embedding in my body, each cell. And each cell, its own fluid inside the cell that is surrounding each organelles. So we have to be aware, know ourselves. Otherwise, we cannot be effective in tackle all what Bruce Lipton says, the change the behavior. Because he says the epigenetics is mainly changing the behavior. How can I change the behavior if I deny that I have this and that emotion? So I think he's correct, yeah.
Thank you, Yasco, once more.
Some does even the regression to the earlier lives. In order, if this life cannot bring, as you say, any clue, sometimes the good psychologists go to regression and get some key points in their last life, whatever that bothered.
Thank you. With this, then, we conclude our evening tonight, and we would like to invite everyone for our spiritual passes. And
thank you.
And guide ourselves